Audrey is a registered genetic counselor who joined the genetic team at Guy's Hospital in 2019. Her special interest is in pre-implantation genetic diagnosis, which is now a widely accepted and available fertility technique for planning an unaffected pregnancy. It is applicable for many conditions, including Marfan syndrome. She has recorded her talk for us today. May I introduce Audrey?
I'm Audrey Deering. I'm one of the genetic counsellors here at Guy's Hospital. There's 2 PGD clinics in London, CRGH, and we're the other one based here at Guy's. So as you might have picked up, PGD is a technology that uses fertility treatment, even though the vast majority of our couples do not have any underlying fertility issues. And what we do is we try to create as many embryos as we can and test them for a specific genetic condition. So Marfan syndrome as an example. It's not a form of gene editing. So if the embryo has inherited Marfan syndrome, we're not able to take the Marfan syndrome away. We just simply do not use those embryos. And this is a process that's strictly controlled in the UK. So the governing body is called the HFEA. So they make sure that these technologies are used ethically and responsibly, and we don't select for things that are not serious, like blue hair and blonde hair or blue eyes or anything like that. Overall, the process of PGD is quite lengthy and complicated. So usually couples will have no underlying fertility issues, but we still want to give them a barrage of fertility tests just to make sure we know what we're getting into. We then give the female partner hormones to stimulate her ovaries to make lots and lots of eggs. We collect those eggs from her and fertilize them outside of the body with her partner's sperm or a sperm donor. We then grow them up until they're about a week old, until they're big enough that we can safely do genetic testing on them. And then again, we look for Marfan syndrome, and if the embryos are unaffected, we transfer them usually one by one until hopefully a pregnancy occurs. So this process, PGD, is funded by the NHS for couples and individuals in certain situations. So if you are coming forward as a couple, we ask that you are in a stable relationship and are living together and have been in a relationship for at least a year, but you do not need to have been living together for a year. We also do not discriminate by gender, so it can be same-sex couples, heterosexual couples, or single people. If you require, for example, sperm or egg donation, the process of donation, unfortunately, is not covered by the NHS, but everything else around PGD is. We also ask that women are under the age of 40 by the time their treatment starts, but we usually ask for a couple months under the age of 40 to give us time to do that fertility workup and make sure that we can get you to testing before your 40th birthday. And we also ask that your body mass index for the female partner is in between 19 and 30. The reason for that is that the hormone medication that we give ladies is what we call fat soluble. So if your body mass index is too low or too high, the hormones might not pass through your body the way that we want it to, and it can decrease the chance of the treatment working. We also ask that both people in the couple are non-smokers, including vaping. So even the vape fluid can damage sperm and egg quality, and again, we want to increase the chances of it working. And the last criteria is that couples must not have unaffected children together. So in other words, if you have a child with Marfan syndrome, you are eligible for NHS funding. Or if you have a child from a previous relationship, so not in a current partnership, you are also eligible for NHS funding. So it's a little bit different than the IVF funding. So these are the funding criteria for Wales and England. I'm afraid I'm not aware of Scotland, but I think it's quite similar. For Northern Ireland, they have the same criteria, except couples are able to have unaffected children together. So that is just for England and Wales, that last point. So it obviously sounds fantastic, but there's more than that to consider. So we also think about if the female partner is in a stable place from a health perspective. So especially if the female partner has Marfan syndrome, we will ask them to be assessed by a cardiologist to make sure that their heart is stable enough for them to undergo what we call ovarian stimulation and to carry a pregnancy. If they are not stable enough to carry the pregnancy themselves, they can consider a surrogate. But similar to sperm and egg donation, unfortunately, surrogacy is not funded by the NHS. But of course, you'd be very welcome to find a surrogate, and we can work with that. And obviously, it's a long process, just partially because there are some NHS wait lists associated with it. But even if there was no NHS waiting, it's just a complex procedure and it takes a long time. So we also know that not every cycle works. So for couples with average fertility, about 2/3 of them will walk home with a healthy baby, whether that takes 1 attempt or 2 or even 3. So it can be a long process that might not work. So we as genetic counsellors are obviously here to provide support, and we'll also help work with you to identify other support that you might have, or we can even put you in touch with professional support if you wanted to speak to somebody during the process. The way that PGD works is we like, if possible, to have DNA from other people in your family. So if the couple with Marfan syndrome has an affected parent, we find that extremely helpful. If nobody in your family has Marfan syndrome, or for example, if you're adopted or you don't have contact with people in your family, we can still do our very best to try to develop a test for you. We can't guarantee that it will work, but we will be very happy to look at your family tree and to look at the genetic information that we have to see if we can develop a test for you. And we also accept genetic tests reports from what we call a UCAS accredited lab. So usually that's an NHS lab. So if you had your test done maybe in a research setting, or maybe you had your test done a long time ago, we'll ask your genetic counsellor to repeat that for you, just to make sure that we're working on the best possible information. On our website here at Guy's Hospital, we have some other stories. Nobody with Marfan syndrome, so if anybody wanted to share how they found their PGD through Guy's, but it might be worth just seeing what other people went through, and might give you an idea of how you might be able to cope with the process and to kind of highlight that you're maybe not alone going through this process. If you did want to think about a referral for PGD, even if just to help you make up your mind whether you'd like to go ahead or not, your local clinical genetics service will be your first port of call. So we ask that all referrals come through your local genetic service, and again, they'd be able to give you more information and to arrange another appointment if you'd like. And also, here's our website for us here at Guy's Hospital. So we've got some again, lovely patient stories and some more specific details on how the PGD process works.
Right, we have time for a couple of questions. Is there any question from the audience? If not, can I start by saying that since 25% of our patients with Marfan syndrome are the first ones affected in the family and don't have an affected parent, can they still be considered for IVF and pre-implantation genetic diagnosis? And we get this question quite often, actually. If they have a causative mutation discovered through a genetic lab, then this is entirely possible. If it's not clear whether the mutation is causing the condition or not, we can still have a try. And we do have labs, specialized labs across Europe that help us out in England with the very latest techniques. So do come along and ask. You have to be referred through a genetic department in the UK, and that's because they are responsible for deciding whether the mutation is causative or not. And then the couple are referred on to a special center like Guy's, with the mutation having already been checked. So this is a rather long process, and I would urge any couple that's interested not to leave it too late in the marriage. You know, you should start thinking about it in the early 30s anyway, to plan this journey, as Maggie points out. First to the GP, then to the genetic center, then to have the blood tests and the mutation checked, and then referred onward to the specialist center for a year of preparation, leading to a final implantation of a fertilized, unaffected pre-embryo. If there are any left over, they can be kept frozen down. so that if you come back in a few years to collect a second one, then the charge is much less. They don't have to start at the very beginning all over again. Does that sound sensible? I think it's certainly worthwhile, because if you think when you came to genetic counseling that there was a small chair in the room beside the parents and the baby was sitting there and you said, "Dear baby, would you like to have Marfan syndrome, or would you rather not have Marfan syndrome?" I'm sure you know which answer the baby would give. So we really are creating a new life, and it's a chance to get rid of the gene from the family. Any other questions?
MT has asked or commented, is BMI of at least 19 really required for a Marfan person?
You can be slim, but you can't be overweight. That's the worry, because if you're overweight, fat cells actually make female hormones, and that can complicate the process.